We are live.
Well, it's 5:31, so we might as well begin. Welcome, everybody, on this wonderful spring-like, fall-like day. I will call to order the meeting of the Health and Human Services Board for October 22nd. Obviously, this meeting is by teleconference, and so there will be no public comment, but we're grateful to members of the public who are watching, and know that you can always email or call us if you have questions or concerns, and we welcome your feedback. So let's go ahead. I will go ahead and call the roll. Supervisor Bjork, not absent. Bonnie Barker, Jody Cromry.
Here.
Bill Lamb.
Yes, hello.
Hello. Sarah Kennedy. Sarah Schaefer is in the ER. Supervisor Steen.
Here.
And Chairman Bartlett.
Here.
Good. Thank you. Thanks, everybody. We have minutes in our packet for our meeting on September 24th. I'd like a motion to approve.
I so move.
Supervisor Steen moves. Is there a second?
I'll second that. Chairman Bartlett.
Chairman Bartlett, second. Any discussion, additions, corrections? Supervisor Cromry?
Yeah, I just noticed on point 3 that my last name was spelled incorrectly, if that needs to be updated.
Absolutely. We will note that and send out.
Oh, it is. Sorry about that.
Yeah, and I'm sorry, I didn't notice it either. We will correct that and get it out. Thank you. Any other additions or corrections? If not, all in favor of approving the minutes for September 24th, say aye.
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 Aye. Thanks very much. Next item on the agenda is review of the next meeting date, and it actually is scheduled for Thanksgiving Day, and we thought perhaps you might like to do something other than meet, so we have scheduled it for the preceding Thursday, not our regular fourth Thursday, the third Thursday, which is the 19th of November. Does that pass muster with all of the committee? All right, we will see you again on November 19th at 5:30, and I'm presuming that that will be a remote meeting as well. Item up is Veteran Service Office. Greg, welcome. I'm sorry.
Good evening, everyone.
No, we moved it. Yeah, we're working from the amended agenda. I'm sorry, Chris. We're working from the amended agenda, so it's down in action items. All right, you are on now, Greg.
Okay. All right. Good
Thank you.
evening, everyone. So this evening I'll provide the Veterans Office staff report. I'll start with the monthly report, the items of interest. Just a kind of a quick narrative of what is going on in light of, so you can kind of a read ahead on what to expect the discussion is from the office. So locally, our office fully staffed, conducting in-person appointments, of course, following all COVID protocols. Seen over the last probably 90 days an increase in contacts from adjacent county veterans looking for services, just based upon what's been expressed as inability to be able to contact or meet with the other service officers to assist with a variety of claims benefits. So the other thing is which I'll have some more follow-up information. We had I reported to the board a UW extension grant that had approved it. We're partnering with Pepin County as well as Buffalo County, and we we ended up going through a little bit lengthier hiring process for a part-time employee for that program, which it's all paid for out of UW Extension. So zero financial impact on the county outside of match, which is using some office space here. And so we just made a decision on the hire. And so I'll provide more next month upon that being them accepting the position. And again, it's a part-time. The grant consists of, I'll say a 3-phase project where it's initially gathering information, pulling together the stakeholders within law enforcement community, as well as those that work with veterans. And then kind of phase 2, providing a training or putting together a training. Phase 3 will be conducting that training to be able to, best way I can describe it is assisting those that work with veterans to understand the military mind and in working with them and their actions to be able to provide the best services for them. And then there's a pilot program that we're hoping to kind of get started from this, more of a battle buddy concept, 9-line type concept. There's a couple military terms that basically you don't ever leave anybody behind. You take care of them. And 9-line is just a military method to provide necessary information to be able to evacuate a casualty off the battlefield. So we got that going out. There'll be more to follow as we continue with that. State benefits, really no delays in any of the benefits. We for this on the state level, there's most of the stuff we're able to just handle with limited contact with the State Department of Veterans Affairs because of the systems that we have access to, but really haven't seen much of a delay in any of the services and contact we need from them to accomplish our tasks. On the federal benefits level, nothing significant to report. Financially, I've provided the staff financial report, and with that as well, I'm open to questions on our financial report, expenditures or revenues, but nothing significant to report. I fully anticipate maybe close to a couple $1,000s in savings for the tax levy that based upon, I'll call it COVID savings because stuff is done remotely. If there's no questions on the financial part, I can move into more of the emergency preparedness COVID-19 kind of discussion, which I definitely want to highlight and I can only speak for my program, an improvement for the public to be able to access services. There's a camera now that allows individuals, they're able to see, we can pop that up on our screen, and there's a phone in a kind of a small entryway so that the public can step in out of the elements. And it came at a very, very good time. And they're able to make phone call again. We work with population, audiology, hearing difficulties are very, very common. Not everyone, the assumption is everyone has a cell phone. That's an incorrect assumption. And so I really see that as a positive improvement and that good perception to the public that we're trying to do everything we can to continue to provide services. Any questions about any of those items that I covered?
Greg, the contacts from other counties, does that pose any difficulty for you? And
yeah, so we have an internal unwritten policy at this point, but I have to get it articulated. So we will do a phone consultation. If some individuals, because they're a veteran and if they're inquiring into things, we'll do a phone consultation. But then we send them back to their county to get the services that they need. And the true end is if there's gaps in services, we want them to bring that forward to their bosses. Similar to if there's a gap in services for the Dunn County veterans, the bosses should know that so that then we're working together to fix that. You know, if it's access to the service officer, access to others to do those benefits, need to know that. So that's kind of the direction we go. If we start working with a veteran in Dunn County and they're transitioning into another county, we'll finish that claim up. We don't, because that continuity of care, they deserve that. Some of this is coming from some of the counties don't have any of their benefits specialists or service officers in the office. Another county had they had a new hire for a service officer. They then left after a short period of time, and they're in the process of hiring. So there's gaps in the services that.
Okay, thank you.
Yep.
Other questions for Greg? Supervisor Steen?
Yeah, Greg, just a question. Has the COVID affected your disability claims timeline, and also has it impacted your appeal timeline?
The appeal timeline, it hasn't affected the appeal timeline because those particular, they call them decision review officers or veterans law judges, are working remotely, and they make their decision based upon the evidence that they have already electronically in the record. So no new evidence is introduced. We're just presenting violations basically of the Code of Federal Regulations that they didn't follow. So that I don't really see much of an impact in that. When it comes to initial disability claims, they're early on in the COVID process, that created a delay because all of the disability claims require medical exams. And there was a delay in those medical exams in getting the providers, because the Veterans Administration does not conduct them. They outsource them. And so I think it was probably May or June, they started to get their contracted vendors providing those disability examinations. So a little bit of a backlog. I'll just say one example and not go too deep down the rabbit hole. Sometimes there's records requests that the VA makes because it's their responsibility internally to pull in all federal records. It's our responsibility to pull in all of the pertinent private medical records, other statements from family members, loved ones, or other professionals to help support a claim. The VA makes those records requests to the National Personnel Records Center down in St. Louis, and they pretty much have come to a screeching halt because it's on-site activity, and that's down St. Louis. However, I just got an email back, to just use one example of how the process can work, is I reached directly to the Veterans Benefits Administration, people outside of the regular pathway, because we had a World War II veteran that he had a positive opinion for his claim. The medical doctor had already conducted that. They were holding off. He's 96 years old in an assisted living facility, and they were holding off making their final decision because they did not have his service treatment records from military service. So I assertively informed them that there are really no records, because they had already made a decision. His were burned in a fire, which he fell into that. And so I showed them their own paperwork in an attachment in an email, and they, within 24 hours, have already cut him a check, and we're going to get him his hearing aids. So it can work, but there are some delays on those initial claims. But it's our job. I put it on me, myself, and my staff to make sure that we can mitigate those delays.
Thank you, Greg.
Well done, Greg. Well done. Any other questions? We will be looking at a resolution under action items to support the Commitment to Veterans Support and Outreach Act. And we'll get to that when we get to that point on the agenda, unless there's something you would like to add on that now, Greg.
I would like to just highlight impact statement. I try to share a few things, so kind of have little bit of a good news story. And so you're able to visualize and understand, you know, that true impact of what happens from the office. And I'm just going to talk mainly about the one when it comes down to the appeal process, the Veterans Administration. If an individual receives mental health counseling for a lengthier period of time, you have a long historical on that care. So you're able to do a deep dive into that individual from childbirth up until the current point of time. And sometimes there's information that is disclosed in that from childhood trauma. And the VA has a tendency, or their examiners, to look at childhood trauma, even though they've never received any mental health treatment or anything, and they've been very, very well adapted. Then they hit military time, and they serve. And in this particular case, this young man had served in some pretty heavy combat, the first wave into Iraq, and lost some friends, and things really started to impact him. Then he sought chaplain services in theater of combat, as well as mental health counseling. He'd been through alcohol treatment a couple different times over the last 10 years. But we approached it a little bit different with the appeal. This was done outside of the county, and so very happy to call the young man to let him know that, hey, they've now validated, even though there was some childhood trauma, that is not what truly brought out the lengthier, more difficult challenges that he's had. That combat was that kind of that final trigger that really exacerbated things. So I think that's an important thing that he may not have, if we wouldn't have dug in a little bit deeper and created that continuity of care and that full picture and history, he wouldn't have that safety net. So I think that's an important piece. So I'll end with that unless there's any questions.
Any questions? If not, thank you very much, Greg.
All right, thank you.
Reports are always very helpful and thorough. Item number 6, Department of Public Health Staff Report, KT.
Let me unmute first. So I sent you guys some materials today, so I appreciate that. You haven't had a bunch of time with it. I can bring them up on my screen so we can talk through them.
Please.
While they are up. Okay. Let me. All right. Okay. So right now what you're looking at is our SITREP or situational report. And so this is an amalgamation of a couple different reports that you can get access to online. This first one is what we put out on Facebook every Monday, Wednesday, Friday that gives a snapshot of where we are in Dunn County by the numbers, honestly. And so as of today, as of last night at 9 p.m., we had 928 confirmed cases. We finished out last night with an additional set of cases that were worked today, and then we're at 31 new cases right before the meeting.
In addition to the 928?
Yes.
And weren't we at 900 on Wednesday?
Yes.
Thank you. Just checking.
So it gives you just kind of as you follow them, you can kind of see where we're at. If you want data in between our social media posts, you can absolutely go to the Dunn County data portal and see that data slightly differently represented, but still very much in its entirety. And then you've got, again, some additional data that you can get from the CDC, some additional data that you can get from DHS. I find this metric really helpful in that it gives you kind of our trend line of new cases over time. And there's two things that I want to point out to you guys: that we had 1 day off for WEDS being down, the Wisconsin Electronic Disease Surveillance System. So no cases came through WEDS from doctors' offices. And then we had another day where we show actually a negative case count. And so there's a reason behind that. We were doing, sorry guys, we were doing some data cleanup in anticipation of the WEDS reboot. And we had found that initially we had a set of cases, 8 cases that had been marked as confirmed when they only had antigens. And so they were actually reclassified as probables. So it wasn't that we didn't have any cases come in that day. It was that it was offset by the proper classification, again, that data cleaning to probable for those cases that were moved over. Does that make sense? Mm-hmm. Okay, thank you. And then this is again the hospital readiness health, let's see, WHA's kind of dashboard. Again, you can look at that. I know it's pretty tiny on this infographic, but you can look that up. And what I want to say about that is that most of our regional hospital or most of our hospitals here in the region are at peak census. Many of them have activated their surge capacity plans as where they bring in additional beds. Anecdotally, we are seeing people that our tracers are encouraging to go to the emergency department, ED, because of very severe symptoms, and they are being hydrated and put on oxygen and sent home. We've had 2 people in advanced age sent home alone. That says to me that our healthcare system is overwhelmed here in Dunn County, and that is incredibly concerning. But you can look at the data on WHA's data portal, and you can look at the data on hospital beds on both our portal as well as the DHS portal. The other thing that you guys need to know is that we are in crisis standards of care for contact tracing in Dunn County. I will put a press release out tomorrow. What that means is that we are no longer able to aggressively contact trace and find all of our contacts and get them quarantined. Instead, we are having to prioritize significantly to just make the phone calls to our positive cases. So the challenge is we have seen a shift in demographics. Initially, when we were struggling to keep up with cases, those cases were in a highly socially mobile 18 to 25-year-old range. And we had a cadre of stout contact tracers, which doubled our ability to do that contact tracing. Now, with our shift in demographics, we are seeing cases in less socially mobile people, not in that same age demographic, and we don't have the same surge capacity and contact tracers. So my contact tracers at the health department have 4 to 6 cases to work a day. So we need to work through those as effectively as we can and as quickly as we can so that we don't have positive people continuing to go to work. Because what we're seeing is that very often people are presenting with mild symptoms to start, and those symptoms are getting gradually worse. So stuffy nose, a little tickle in the throat, that kind of thing. But then, as they progress through illness, do have more substantial, more characteristic cough, really sore throat, shortness of breath, diarrhea, those kinds of symptoms, loss of taste and smell. Not that that's severe, it's just quite annoying and very highly correlated with COVID right now. So that's kind of the situational update. There are additional links that you guys can go to if you wanted to find some more information. The other things that I sent you is the weekly update. So this is our public health consortium that again gives you an idea of where we are in activity. That's always important to look at. But then if you go through, there's a lot of different information that you can get to. Right now, we have worked with the Wisconsin National Guard to increase testing capability. Right now, Dunn County is at about 8.4% positivity, meaning about 8.4% of our total people tested have tested positive. So anytime we're over 5%, we want to make sure that we can increase our testing capacity. So we have worked with emergency management and facilities to set up COVID-19 testing. This is this week's testing schedule. I also sent you next week's schedule. Next week on Tuesday, we will be hosting a testing event at the small animal pavilion over at the fairgrounds. It's completely drive-through, so we're hopeful that it's really nice and accessible. We can process 300 tests a day. And so our hope is that for folks that find it's a barrier to make an appointment or it's a barrier to pay for an appointment, this is going to be a free and easy way to register online, drive through, and get tested. It's also the nasal test. So for folks that are uncomfortable with an NP swab that kind of reaches way far back, this one's a little gentler and it's just in your nostril. And again, there are some links if you wanted to get some more information on that report. Okay, and I feel like those are my COVID updates. I know that there are a couple other items in our action items today. So I'll go ahead and stop sharing and ask if you guys have any questions.
Yes, Supervisor Steen.
Yes, KT, how are our schools holding up?
I am so grateful for our schools. They really are working very hard to do all of the things that we've asked them to do to the rest of their ability. And it's really to the credit of our schools and the strength of their mitigation plans that we have not seen, as far as I'm aware. I've not checked my cases today, but as of earlier this week, we have not had any transmission specifically related to in-classroom activities. We have had transmission among students, either from family members or from social gatherings or that kind of thing. But we haven't had folks in a room together in a class have transmission. So they're doing reasonably well. We are tracking their absentee rates. We want to make sure that we don't have a rolling 4-week average of greater than 20%. And all of our schools right now are less than 12%. And so that's good to see. And that we have staffing available to do the instruction. And so that's where we're at with those.
Thank you.
I'm sorry. No, I don't see Bill's hand, but Bill's hand must be up.
It is just KT, that online the testing next week, the mobile testing. Can you just say what day that was and where again quickly, please?
Sure, absolutely. Thank you. So it is Tuesday from 11 to 7, and it's at the Dunn County Fairgrounds.
Okay.
On, I'll just pull it open so I can read from it. 620 17th Street Southeast. It's actually, you're going to enter on the Main Street side, and then you're going to drive through. But the address will get you there by putting that 620 17th Street Southeast in.
And then if a person, I'm just going to kind of, within my little sphere of influence, I'm just going to spread that around a little bit. And then if they wanted to register online, but to do that, tell me again where to send them.
So you can register online the day of, and the link is in the flyer that I gave you, but it's https://. So you can ignore that or you can put that in, but it's really easy. It's register.covidconnect.wisconsin.gov. That's register.covidconnect.wi.gov.
Perfect. Thanks.
Other questions? Yes, Chairman Bartlett.
You mentioned that here in Dunn County, the hospitals are filled up. Is the hospital now taking COVID patients? I guess I had understood that they were sending them to Eau Claire.
Sure. So our hospital does take COVID positive patients. So what they don't have capacity here is acute care or ICU bed space, but they do have a negative pressure room, and they are taking COVID positive folks.
Okay, so the ones that they sent home, they evidently were good enough that they didn't have to be hospitalized.
One would assume.
We would hope that, I guess.
Yep.
Okay. And your testing that's coming up, that's for people with symptoms only, correct?
Symptoms or close contact. We want to maintain those resources where they're needed. So
Right.
instead of folks just being curious, we really want to use those for symptomatic and close contacts for folks that are over 5. The Guard doesn't like to work with the itty bitties quite so much.
Other questions or comments for KT? As always, thanks to the Public Health Department. This has been a really long haul, and you and your staff are doing a really wonderful job under very difficult circumstances. So hang in there.
Thank you.
Anything else on your report, KT?
No, I would share that we are encouraging people to get their flu shots. We really hold back what we can do in the office because of COVID-19, but we are still providing flu shots for people that either have Medica insurance. We'll bill them, so it'll be free to you, like every county employee that takes the county insurance, or Medicare. So many people, like we would go before the county board meeting and do flu shots, they can still come down, make an appointment and get a flu shot. It's incredibly important that you get a flu shot because it's one of those things that we can all do to reduce the strain on our healthcare system. Thank you.
Are there shortages of flu vaccine, or is it widely available?
So I have heard that different health systems and pharmacy systems have had some shortages because people are heeding the call to get a flu shot. But I have heard that most of those supply chains have been able to be reinstated fairly quickly. I haven't heard about the high, I'm not going to use the right word, but kind of the dosage that they're encouraging for elderly folk. That has been one of the ones that has been more difficult to come by.
Okay, thank you. All right, moving on to the Department of Human Services staff report. Do you want to introduce Carrie, Chris?
Sure. So I would, well, I just would note, I did do a brief written report, which is in your packet, which you could read, and you don't need me to say anything about unless you have some questions about that. And then I invited Carrie Anderson. Carrie is one of our long-term employees, getting to be longer term. 20 years, Carrie?
21, I think, this year.
21 years. Yep. Carrie's been with us. She was just a baby when I came here, and now I'm the same age and she is much older. But Carrie worked for a really long time doing child protective services work. And then some years back, she became a manager in the Family and Children Services section. There are 2. She shares that task with her colleague and good friend, Lori Radcliffe. But Carrie is going to talk with us today, do a presentation today on what you might call juvenile justice. We are trying to adopt the word youth justice because nobody wants to be called a juvenile. Nothing good goes with juvenile. But Carrie's going to do a presentation on youth justice services in Dunn County. Carrie, can you share your screen from where you are? Or do I have to co-host?
Think so. Let's see. Can you see it?
Yep.
It's coming.
Okay.
So thank you, Carrie.
Perfect. Hi, everybody. Good evening. As Chris said, we used to be called juvenile justice, and within the last few years, the state has really put a lot of work into kind of revamping what juvenile justice is or has been for the state. One of the really cool things that they did was they brought in a bunch of youth throughout the whole state that had been through the juvenile justice system and asked them all kinds of questions and really got their feedback in regards to what it was like to be part of that system. And one of the things that they had said that really bothered them was being called the juvenile justice. That juvenile automatically brought this negative connotation along with it, like they were always up to no good and that they were labeled. So they went back, and the state has now changed it from juvenile justice to youth justice, which I think is pretty cool thing. So the state has done a number of different things. That's just one of them. One of the newer tools that we've been using, and I'll talk about that a little bit later, is called the YAZI, and the state is currently training all of the counties in regards to this new screening instrument that we use. It was really kind of fascinating coming from child protection. I had done child protection initial assessment work for over 15 years, and we had hundreds of pages of state standards that we operated by. And so there was a uniformity amongst all of our counties in the state in regards to how they did things. And then when I went over to youth justice, there's nothing. I mean, there is no standards. We have 72 counties, and they're operating youth justice in 72 different ways. So the state is really trying to come up with different ways to get all of the counties on the same page. So you would get similar service if you went to Dunn County and similar or in treatment, if you went to Pierce County or Sawyer County. So just a little bit about us. This is our youth justice staff. We have Tracy, who's our juvenile intake worker, Sarah, who's Danielle, Jenna, Christina, who are ongoing social workers. We have 1.5 social service aides, who would be Clint and Samantha, and then there is myself. Now, my workers that are listed on here, also several of them also carry half of the caseload of child protective services as well, because our numbers have been so great in child protection, and they've also had a willingness and a want to learn child protection. And both Lori and I operate under the kind of the idea of, we're going to keep our workers intrigued and wanting to stay if they're able to, to learn and grow and do things that they love. So we do let them kind of dabble in both youth justice and child protection. And I would just argue that they become more well-rounded social workers anyways, because most youth justice kids are growing up child protection kiddos. Not all, but I would most. So if you're going to come to youth justice in Dunn County Human Services, you can get to us in one of two ways. The first one would be truancy, so through a truancy referral from the school. And then the second one would be delinquency. So I'll kind of give a rundown of both of those. So truancy, basically after the schools determine that a youth is truant per the Wisconsin Statute 118, then they send a truancy referral to our department. What happens then is our juvenile intake worker sets up a meeting and meets with the youth and the parent. So, or parents. And they're also talking to the school, getting those attendance records, things like that. So basically, what can come out of that meeting is that we do, we can either do what we call a counsel and close. Sometimes by the time they get to us or by the time that they've come into us, sometimes knowing that they're getting referred is even enough to, you know, to correct the problem. And so things are much better by the time that they come to us. So we could close those ones out. For example, we could put them on a deferred prosecution agreement. We could also do a referral to truancy court. We have a truancy court in Dunn County. If I'm not sure if you all know of that or not, that is something that our past Judge Stewart had started way back in the day. That was kind of one of his true loves, was this truancy court, and it's still operating, and we get a lot of inquiries from other counties around the state who like, you know, how does your truancy court run? And just a lot of questions about that, because it is just nice to have it be a separate court process. And then sometimes a referral to the district attorney's office for a JIPS petition for truancy is necessary. JIPS stands for Juvenile in Need of Protection and or Services. So sometimes these youth, these kids are coming through our door, and it looks like it's truancy, but there are so many other issues that are going on that a formal petition, a formal court order is necessary. So those are the ones that we are sending over to court for that formal petition. So in regards to delinquency, you know, if you were an adult and you went out and you committed a crime, and law enforcement would come out there and they would do their investigation, and then they would basically pass everything on to the DA's office, and then the district attorney's office would basically, you know, get it through the court system. So in the youth justice world, if a youth goes out and commits a crime, law enforcement goes out there, they do the investigation, they determine that a crime was committed, then they send that referral to juvenile intake, to us, instead of sending it to the district attorney's office. So we're basically set up to be the gatekeepers for the court system. So they're coming to us and we're trying to figure out what really truly does need to be sent to court and what doesn't need to be sent to court. So what we do once we get that referral, that delinquency referral, is we have an obligation per statute to send paperwork to the victim. They have the right to tell us about how that crime impacted them and what kind of outcomes they would like to see. And then we schedule an intake with the youth and their parents. So you know, pre-COVID, they were coming into the office. Now we're basically doing all of these virtual, which has presented a little bit of a challenge, but it's working. So the youth and their parents are coming in for what we call an intake. And so when they're coming in for this intake, we're basically telling them, look, 3 different things, 3 different outcomes can happen as a result of that meeting. One is that it can be a counsel and close. Like, you know, for example, a kid gets caught shoplifting at, you know, the gas station, And, mom found out that the shoplifting occurred and she hauled her kid in and made him apologize to the store, or, things like that. There's all kinds of situations where the parents have handled things very, very appropriately, and there's not anything that our department needs to do. So we could do a counsel and close. We could put the youth on what we call a deferred prosecution agreement. And basically that is, you need to do A, B, C, D, and E. You need to pay off your restitution. You need to, participate in this program. You need to go to school each and every day, whatever it might be. And if you do those things, this basically goes away at the end of that time, whether it is 6 months or 12 months. This charge will basically go away. And if you don't do those things, then we can revoke that deferred prosecution agreement and send it over to the district attorney's office for a formal petition on that original charge that they came into our office for. So we're able to do those deferred prosecution agreements right in our office with those youth and those parents. And then the last resort basically is to do a referral to court for that formal petition. And then they would be under a court order. So what we do as part of this intake is, when I had talked about that YASI, the youth assessment screening instrument. So at the point of intake is we're doing a pre-screen on them. So one of the really cool things about this instrument is that it doesn't only measure risk and need, but it also measures the youth strengths, and it formulates questions that the intake worker is asking of the youth and the parents in regards to all of those different things, the risks, the needs, and the strengths. And then at the end of this pre-screen, it basically kind of spits out where they're at. So what that risk level is and what the protective factor level is. So those kids that are low risk, we definitely do not want to be bringing them into our system. There's all kinds of research out there that shows that by bringing low risk youth into the system, you're going to make them worse. So we might give them community resources. If you're struggling with this, or if the family's struggling with that, we can tell them where in the community to go get resources, but we don't want to be bringing those low risk youth into our system. The moderate risk ones, they'll tell you can either do like a deferred prosecution agreement, or you can also do that counsel and close. And then those high risk kids are typically the ones that are going to get referred to court for that formal petition. So those are the youth that we really want to focus on. We want to focus on those kids that have high risk to reoffend, and that usually comes along with those low protective factors. So those are the ones that are usually getting referred over to court. There are certain circumstances such as a sex offense, sexual offenders, we are almost always referring those over to court, even though they might come up as a low or a moderate, which is typical. We've learned in our YASI training, typical that they would come up as low or moderate on that scale. But a lot of times, just to make sure that they are getting the right service and service needs, we are referring them over. So once the youth basically goes through the whole court process, there's a plea hearing, they can, enter an admission, they can enter a denial. If they're entering a denial, we can have, other court hearings, fact-finding hearings, to make sure that the judge finds that, yes, this youth did commit this crime. So there's a series of due process court hearings that are involved between that point of us referring to court and the youth getting put on what we call a dispositional order. So once they're on a dispositional order, they are basically getting passed on to an ongoing social worker. So what that ongoing social worker does is they're administering the full YASI, which is assessing 10 different domains. So you're looking at the legal history, family, school, community, peers, alcohol, drugs, mental health, violence, aggression, attitude, skills and employment, and free time. So basically, what that full YASI does is at the end, after you plug in all of your information, it comes back with the 3 different areas that you really need to focus on in your case plan. The 3 high risk areas, or the 3 areas where this youth really needs to develop skills. So that's where the social worker then is basically focusing their energy and their time, is trying to figure out the best service to get that youth the skills that they need. So some examples of ongoing services that a youth may receive. I on the top here, I wrote that we're serving the family. You know, we sometimes get those calls like, you know, I'm sick and tired of my rotten teenager, and, you know, you need to come and get this kid, and this kid needs to go somewhere, and you need to treat them, and then you can put them back in my house. And it's like, yeah, it doesn't work like that. So, you know, a lot of times parents need skills too. So, you know, we're serving parents as along with the youth, because we know by serving the whole entire family system that we're going to have some better outcomes here. If those parents are able to gain some skills, to you know, maybe learn how to provide better supervision, or not engage in, you know, in so many fights with their teen, or whatever it might be, we know that we're going to have better outcomes. And then my thought is that there's usually other little kiddos coming down the pike. So let's get the family what they need now, so we're not serving all of the kids in youth justice as they kind of get a little bit older. So we can be doing, based on what the YASI is telling us, we can be making referrals to things like mentoring, day treatment, victim impact panels, the many different types of therapy that are out there. You know, we have multidimensional family therapy, EMDR, DBT, family therapy, in-home therapy, alcohol and drug abuse, you know, counseling, so many different types of therapy out there. And we're also constantly doing ongoing team meetings. So we are bringing in the parents, we're bringing in the youth, we're bringing in school providers, or school professionals, providers that are working with this youth, and we're coming to the team and we're trying to figure out, you know, start trying to make sure that we're all on the same page, and basically come up with a game plan in regards to who's going to do what, who's responsible for what are our next steps. Our youth justice social workers are doing home visits. They're in the home, not so much right now, but they're in the home working with that family. We do our own electronic monitoring. So if youth need to be hooked up to an electronic monitoring device, that's one of the things that our social service aide is responsible for, is putting on that device and then doing all of the monitoring of where that youth is at. We do carry guides with the youth, which is a tool, an evidence-based tool that we use to address some cognitions and thinking. Restitution, we're keeping track of community service. And the last is if they do need to be in an out-of-home placement. So if you know, our community is not safe with them, remaining in our community, we might have to look at, or remaining with their parents or a relative, we might have to look at some type of out-of-home placement. So I did want to just touch on that, because when we talk about costly services and what costs our county the most money in regards to youth justice, it really is these out-of-home placements. So I just put some numbers up there. A foster care placement can run us anywhere from $600 a month to $2,000 per month. That's the most that we can pay for a foster care placement. The problem with teenagers is that a lot of times after teenagers have had some behaviors and committed a few crimes, they don't really look great on paper anymore, and foster parents kind of tend to shy away from teenagers. There's just not a lot of foster parents out there that have a love for, bringing a naughty little teen into their home. So, I think a lot of times our youth could be served in a foster home with services wrapped around them, but it's just really, really hard to find. So then you find yourself going up to the next level of care, which is group homes. Group homes run us, which would be like our local positive alternatives, for example, the one that we have right in our community, right in Menominee. They're around $240 a day, or $7,200 per month. We are in a situation in our state where we don't have enough group homes or residential care centers. So the groups homes and the residential care centers basically get their choosing of the kid that they want there. So even though you might want your kid to be in a group home, your youth to be in a group home, sometimes you have to go up to that next level to residential care, because, we have had workers who literally contacted 40-some group homes throughout the state of Wisconsin, and not one of them is willing to take our youth. So then you're basically going up to that next level of care, that residential care. And you're making all of those same phone calls and same efforts. Many of these facilities now are doing an interview with the youth to try to figure out if they'll even accept the youth into their facility, and we have to supply them with a ton of paperwork. They want to read all about this youth before they decide to take them. So residential care, a place like the Eau Claire Academy, is running about $410 a day, or $12,300 per month. So both in group homes and residential care, the youth is living there. In group homes, they're typically going to school in that community. So those youth that are placed over at Positive Alternatives, they're going to school in the Menominee School District. And then they're getting their therapy basically out in the community. They're going out in the community for their different services. In residential care, they're also living there, but they attend school there, and their service providers are basically all right there, in that facility, so the youth aren't leaving. So that's the difference between those ones. So Chris just asked me to kind of touch on some of our youth that we have served for a long time, and and why they do get so costly. So one of the situations that I can think of is our youth who sexually offend on a sibling in the home. Those youth almost always need to, not always, but sometimes, especially if the victim feels unsafe with that person in the home, or you're just not able to put in enough safety provisions in that home, that youth will need to be removed from the home. That offender needs to leave, so the victim gets to stay with the parents. And there are very few foster homes that are willing to take in children with any type of sex offense behaviors, just because then usually that youth needs to be the only kid in that home. And then if they, say that they could go to a group home and receive sex offender treatment and, successfully complete it, sometimes the parents aren't wanting that youth to come back home, and sometimes the victim is still not feeling safe or okay for that sibling to come back home. We do work to try to find relatives that, might not have any kids in their home, maybe a grandma or grandpa or aunt or uncle, that youth could go stay with after they successfully complete that sex offender programming, but that's not always the case. So sometimes those youth are staying in care for an extended period of time just because we can't find another place that they can safely go to. One other very special case that I can think of is this young lady. Well, she's actually 16 now. But she came to our department when she was 4 years old. And we've been serving this family on and off for since she's been 4 up until the time that she's 16 now, mostly on. And I actually was the social worker, the initial assessment child protection worker back in the day when this little kiddo came into care at the age of 4. She had lived in a crib basically her whole toddler years. Her mom was depressed and an alcoholic, and the dad was incarcerated and nowhere around. And this mom just basically kept this child in the crib, and she basically would toss cats and kittens into this crib to keep this child company. So she was 4 years old when she came to us, and she thought that she was a cat. She had no language. She just basically meowed and clawed at you and hissed. And we had no idea, what was going on here. So that we really started working with the family back then. That kiddo has been in and out of placements. I mean, just severe trauma. And along with having severe trauma, she's also got a pretty low IQ. So she was served through child protection a bit, and then as she grew a little bit older, she couldn't function in school. Nobody could care for her, and so she came through the youth justice door again, as basically a juvenile in need of protection and or services. So a JIPS is what we call that. And she's at the point right now where we have her in one residential care setting, and she is needing to be moved. They have put in their 30-day notice and actually would love for us to just immediately remove her. And we're having to put her into another residential care facility. But unfortunately, she is one of these youth that is just, she's got a lot of trauma, a lot of things going on, and tons of attachment issues. And, so she kind of bounces. And honestly, I mean, my worker, Sarah Steingrubel, has worked with this family for years and years and years. And she has worked her butt off to try to keep this kid in her home, and which she was able to successfully do for quite some years, but it just got to be way too much for those parents, and they were starting to get physical with her, and she needed to be removed. So now she's been in residential care, and of course our concern is that she's going to bounce from place to place, and this is what we've been trying to avoid for so long. But yeah, these are the tough ones. These are the tough kids, and I wouldn't consider her to be a youth justice kid just because of, you know, all of the things that she does have going on, but those are also the kids that we are serving on our unit as well. So on that happy note, does anybody have any questions for me? Anything that you guys want to know more about, or why do you do this or not that? Anything at all?
Carrie, I presume this heartrending last case study that you shared, that keeping a child in service for 12 years, is that typical?
No.
Very atypical?
Yeah.
Okay.
Typically in ongoing services, I mean, we're really aiming at, you know, a year. Sometimes those court orders need to be extended longer than a year, but we're really looking at, you know, getting those youth and those families the skills that they need so we can get out of their lives, and typically in that year fashion. So no, she is very atypical, but just a long road for her, and just a costly girl, but rightfully so.
Any questions or comments for Carrie? Hearing none. Thank you, Carrie. That was very interesting. Thanks very much.
Thank you.
Carrie, will you pop out of sharing your screen?
Okay. Yes, Chairman Bartlett.
I just thought of a question. But this girl is 16 years old. At what point does she leave the youth system and I suppose enter a different system, or how does that work?
Yep, you're right. So basically at the point when she's 17 and a half, we will be doing a referral over to the Aging and Disability Resource Center. She is a girl that will always need a ton of supports, and probably need, you know, some help in regards to some type of group home living situation when she is an adult. So she is also served in the waiver program that will continue with her as well. But yeah, we do transition those youth over to that Aging and Disability Resource unit after they're ready to age out of our system.
Any
Thank you.
any other questions? Thank you, Carrie. That was very helpful. Finances are up. Sarah or Chris? I assume this is Sarah's.
Good evening, everyone. How are you?
Good. How are you?
Good. Thank you. I'm going to just keep going along. If we go to the last page of the financials that were submitted to everyone or provided to everyone. For DHS, I'll go right through the projected column. Right now, DHS is projecting to have expenses of $14,157,718. That breaks out to our operating expense at $8,910,249. And that breaks down, the 14 million breaks down to our salary being $5,247,469. And we look like we're going to bring in a projected $10,212,358 with the use of county levy of $3,945,360. Right now, it looks like we will turn back to the county $151,348. Is there any questions? Those are all projections, of course, if everything continues to go as we are right now.
Supervisor Steen, do you have a question?
Hi, Gary.
You are muted, Gary. Gary, you are still muted.
If I may, I think his usual question's been answered.
We just have to give him an opportunity to ask it.
I've been clicking the ask to unmute, but he hasn't seen it quite yet.
Let's try this one more time. Supervisor Steen, you are muted. Well, let us assume with Mr. Lamb that his question has been answered. Any other questions for Sarah? Or anything to add, Chris?
All I would quickly say is that there are a lot of moving pieces right now. So we were a bit all over the page before we settled on an amount for this month, but we did, on a positive note, we did receive almost $100,000 from the feds through the CARES Act funding for Medicaid and Medicare providers. But it's a tough year to track all of the ins and the outs and all that's going on, but I think we're pretty solid. Oh, Gary's been freed up.
Gary has been freed up.
Nice move, Sarah. You blanked me out altogether.
I locked you.
My question is about how many months are we behind for your figures?
We are right into, we just finished up we haven't done September yet because we're just in October, so we're back to August, and sometimes the state grant stuff is still back in July, so it's going to take a little bit. We still get revenue up into February of the next year that we reconcile back.
Just a real quick question on the COVID. Do you see that having a positive impact later in the year for us, the COVID money?
It's helped us upgrade our technology quickly because all of us have been pushed off site. So that's one burden the county hasn't had to expense right now. So, but other than that, as far as getting consumers served or clients served, that's been a negative thing there because we can't see them. Everything is virtual.
Thank you very much.
You're welcome.
Thank you. As always, Sarah, I know that this is, as Chris said, this is a moving target. I know that it's difficult.
It's been a challenge.
Well, we appreciate the work. The chair has made two errors. One, Chris, this is for you. Bonnie Barker has been able to join us from time to time, I've noticed, on the participant and chat list. So please mark her as in attendance. And then secondly, I moved too quickly from the health department report and neglected to ask if there were a financial report. KT?
I do have a financial report. And I don't know that I actually had a thumb war with Sarah earlier today on who's going to present, but I definitely can give you an overview and then Sarah can back me up on what I get wrong. Okay.
Sounds good. I'll stay here.
So I sent out just before the meeting a copy of my 5-column budget. So did you want me to pull it up on the screen so that you could kind of
Would
see it
you-
as well?
Would you, because
Absolutely.
we haven't had a chance to really look at it.
Absolutely, absolutely. So right now you're looking at the Excel spreadsheet. I'm going to make it just a little bit bigger. And what you're looking at right now is expenses. And so one of the things that we did is we looked at our public health administration or our tax levy, and we pulled out the costs associated with the contact tracers, as well as the public health nurses that are doing contact tracing that would have had some levy support for, say, communicable disease follow-up. And so that's reflected in the reduction of year-to-date expenditures versus what was in the budget. So that is positive. It's a good thing. I did want to point out where you will see the majority of those costs at this time will be communicable disease. And so these are the myriad of grants that we had talked about before as far as coming to local public health through federal funding, as well as some of the existing small amounts of communicable disease funding for, say, immunizations, as well as the $4,500 that we already had loaded in our grant, in our budget from 2020 pre-COVID, if you could even imagine. And so what we're starting to show is our year-to-date expense. There are things that are not accounted for in this number around, again, some of the technology needs. So when we have as many contact tracers as we have off-site, we obviously have to provide cell phone service and potentially some laptop ability to work remotely. And so not all of that is necessarily reflected. We have done a quick projection, again, using an average of what we've been able to account for in our Nightingale Notes time tracking. And we do believe that we're going to come close to the amounts for these communicable disease funding amounts. So I think that that's really important to know. What you will also see, and this is really tiny and I apologize, just like in DHS, we are working through the state's reimbursement program, CARS. So we are oftentimes, a month and a half to 2 behind in revenues associated with us basically saying, yes, state, we've had these expenses associated with contact tracing, please reimburse us for the time spent. And so that's not necessarily reflected in our communicable disease funding coming in as well. So I did want to share kind of where those numbers are at just at this moment. I'll also share that many of our state grants do allow for COVID response. That is the majority of what we're doing. And so we continue to pull monies out of Title V or reproductive health, maternal child health, prevention, some of the other grant dollars that we have to do COVID work. Obviously, we are not able to use any WIC dollars for any COVID work, and so that remains stable as it was budgeted. Sarah, what did I miss?
Covered it well. Great job.
Also, obviously a moving target, as it were. Yeah, thank you for this. Questions? Supervisor Steen.
And Katie, I don't know if you can answer this or not, but if we do not have another stimulus plan from the federal government, will that impact the state's ability to reimburse you?
So that's a great question. There's a lot of conversation going among my cohort about funding. So you guys will remember that I shared that we were anticipating having some CDC pass-through dollars. They call it the ELC, or Expanded Lab Capacity Grant. So we have an allocated amount for 2021 and 2022. It is less than what we currently have for half a year here in 2020, and it is intended to go for twice as long. So there is significant concern that if there is not additional federal funds put forward to support local public health and COVID response, that funding will be inadequate to get us through our necessary response.
Okay, other questions? If not, thank you, Katie and Sarah, for this work. I appreciate it. Unless I have missed something else, which is entirely possible. We have a number of action items to take up. The first, and is in your packet, is a resolution to the board to commit to support a piece of federal legislation known as the Commitment to Veteran Support and Outreach CVSO Act. Legislation co-sponsored by Senator Tammy Baldwin of Minnesota and others. Greg, would you like to provide a little background on this?
Yes, thank you. So what you have in your packet, the resolution asking for support on is to add some federal funding into the work that county veteran service offices do throughout the country, but more specifically to fill counties that don't have county veteran service officers. And so it's providing funding to be able to assist with that. It's they're looking at providing $50 million over five years. The National Association of Counties, NACO, supports it. The National CVSO Association supports it. The Wisconsin Department of Veterans Affairs support it. And basically, it's going to be able to provide some money and pass through. It's not for the states to use it to cover any funding gaps. It's to be able to contract with and provide down to counties. What I anticipate the potential benefit for Dunn County, I would anticipate a potential small amount of funding to be able to maybe add a half-time additional support as our office used to have and prior to me taking over, where there was additional support. So that's what I anticipate for Dunn County. But as a whole, as I'd kind of described, where you have veterans searching for some services, this may be able to allow other counties to provide those services. I'd really like to stress in here that this, what's identified is that the county service officers are the first point of contact, boots on the ground for veterans, and it absolutely recognizes that the majority of the money coming in and the support provided to those veterans starts right there, that first point of contact. We're the ones that are the liaisons, the support, and should be viewed as the experts to help navigate the federal and the state systems. And so that's what this helps support. And on top of that, the very first line identifies the high suicide rate for our veterans. And the more support that we have available and even partnering, the less chance that somebody's going to be able to, if somebody's going to make a decision that they can't take back.
All right, with that introduction, this would put put Dunn County on record as supporting this piece of legislation. I will entertain a motion to approve the resolution. Supervisor Steen, Supervisor Cromwell seconds. Any discussion, further discussion or questions? If not, all in favor say aye.
Aye.
Any opposed? The motion passes and this resolution will be moved on to the county board. It will go on the November agenda. Thank you. Action item B, Department PPE policy review for signature. This is in KT's wheelhouse. KT.
Sure. So this is a large, we had talked about policies wanting to be put in front of the board. And so what I sent you today is really our umbrella policy of how do we keep our staff safe when they are interacting with people that because of our community prevalence or because of some of their risk-taking behaviors may have a risk to put our staff at risk for exposure to COVID-19. So the short of it is we do everything that we can to work remotely, and we really limit the amount of time we have folks in. So if somebody was to come in for a normal reproductive health annual visit, everybody knows what those look like. Rather, all the females in the room know what those look like. So it's just a lot done over the phone and through telehealth. And then they come in for their vital signs and anything that needs to be done in person. So that's the first measure, is we're reducing our exposure because we're reducing the time that we spend in person. So the whole visit, sorry guys, still might take 45 minutes, but they're only in office for 15. And so that's intentional. And then finally, we have worked to provide a consistent level of PPE when we're working with clients. And so this became really important because our staff did it right, and it was really good that when we provided a TB skin test for an individual who 2 days later tested positive for COVID, we knew that that public health nurse was properly outfitted in a surgical mask, face shield, gowns and gloves. So just in order to keep our staff safe, we had to change what we're doing, and we decided to formalize that with an umbrella policy that will be signed both by our medical advisor and by the chair, unless you guys have any additional questions.
All right, I need a motion to approve. Supervisor Steen, is there a second?
I will second.
Thank you, Mr. Lamb. Any further discussion, questions about the policy, comments? If not, all in favor, say aye.
Aye.
I,
Any opposed? The policy passes. Thank you, KT. That'll get signed. Item number 3, we need to note review of the September DHS vouchers paid. You have that in your packet. $694,885.47 this month. I need a motion to note review. Supervisor Cromrie, thank you. Is there a second? Supervisor Steen, thank you. Any questions or discussion? All in favor of noting review of the September vouchers paid, say aye.
Aye.
Any opposed? That passes. We have 2 budget adjustments, 2020 DHS budget adjustment, and I'm going to ask either Chris or Sarah to give us just a little bit of info on this because it's pretty dense.
I can do that if Chris is okay with that.
Thank you, Sarah.
For the DHS budget adjustment, this is pretty much our yearly shore up to all the grants that we got or getting. And we shore up if they've took any money away from us, if they've given us any money, if we've done any transfers through GWAR or DHS, all those things. And this is the outcome of it. There's some pluses, there's some minuses, but there is no effect to the county levy. Just looks really messy.
Just looks really long.
It is long. I had to put it together. It is long.
I'll need a motion to approve the DHS budget adjustments for 2020 for a DHS motion to approve. Anyone? Supervisor Steen, is there a second? Supervisor Cromrie, thanks very much. Any discussion, further discussion or questions? If not, all in favor, say aye.
Aye.
Aye. DHS budget adjustment is approved. Public health budget adjustment, is that Sarah as well?
Or I can do it.
Okay.
No, not a problem. So again, this is also a little bit of a cleanup. Some of these things we were kind of up in the air. So Title X funding, it was not in our 2020 budget. We weren't sure that we were going to get it. We were notified of it late in the year. And so that is in front of you. Additionally, we had, I really thought that I had brought in front of you already the breastfeeding peer counseling grant that we have through WIC. but apparently it did not get through all the channels, so that's there as well, $8,000. And then finally, there's a public health emergency preparedness, basically a double allocation for 2020 because of COVID-19. This grant actually runs in a non-calendar year, just to be tricky. And so we will have until June of next year to spend this out. And we are holding this back so that we can have a little bit of cushion in the work that we're going to need to do, especially in those first 2 quarters of 2021. But we wanted to get it in front of you just so that we can account for it.
Okay, thank you. I'll need a motion to approve the public health budget adjustment for 2020.
I'll so move.
Thank you, Bill Lamb. Supervisor Steen, is that a second? Any discussion or questions? If not, all in favor of approving the DPH budget adjustment for 2020, say aye.
Aye.
Opposed? That passes. And one last item, our legislative agenda, which, if the members will recall, we discussed last time with the possible addition of 2 items. You have this in your packet. Items A through F essentially were with a tiny bit of clarification on item F, the Birth to 3 program, were in the county's legislative priority list last year. And then there are 2 new items. Item G, thank you to Mr. Lamb, refers to PFAS, which are a whole group of chemicals that cause both physical health and environmental health, significant environmental health issues. And so we thought we would include that in the package. This is actually the first time that you've looked at this. Last month, we had it as a suggestion to move forward with. And thank you, Mr. Lamb, for doing the work on this. Any discussion about this, whether it makes any sense, whether this is something you would like, the committee members would like to see included in our list of legislative recommendations? Yeah, I see a thumbs up. I don't think we need to take a specific vote on these if the board members are in agreement that this should be included. PFAS. Any comments from KT? No. Okay. No, without objection, then I'll move it on to item H, which again was an item that we simply mentioned as potentially to be included last month. Advocate for increased funding and flexibility in providing nutrition assistance to senior citizens. Demand for nutrition assistance has increased during the COVID-19 pandemic. Any questions or any issues with this one? Okay, again, without objection, we will include that in our list, and that will go to the county board for inclusion in our, and there's Bonnie back, our legislative agenda on the November 10th meeting, correct, Chairman Bartlett? All right. That's it. Any announcements or anything else that the members would like to add? If not, thank you all. Good meeting. Thanks to the staff. We appreciate it. Stay dry out there, and we'll see you on November 19th. Without objection. Yep, stay healthy. Without objection, we are adjourned. Thank you.
Bye, all.
Bye-bye, everybody.
Take care. Oh.
I don't know.